So let's talk about infections after breast surgery without implants. So in particular, breast lifts or breast reductions. So I had a question in my DMs about what happens when you get an infection, how do you manage it, and how do you prevent it? So like I said in prior videos, breast reduction and breast lifts are actually very similar surgeries. And to be frank, an infection is really, really rare. I've never seen a patient with a mastopexy with a post-op infection. And of all of the bazillion breast reductions I've done, I've had one patient get an infection post-op. So this luckily is a rare problem. So preventing infections in breast reduction and mastopexy really starts with your perioperative antibiotics. And this is the one very, very studied thing that's been shown to minimize the chance of infection after surgery. So you can certainly discuss with your surgeon what their regimen is. I know a lot of people are still giving antibiotics for days and days after surgery, but there's no data to support this. I personally don't do it even with drains, which I typically don't use anyway for these surgeries. There's really not data to support the use of prolonged antibiotics, and it just leads to antibiotic resistance. So in the post-op period, the most important thing you can do as a patient, because we turn it over to you after the operation, is to keep everything clean and dry and alert your team if anything looks abnormal. It's very common to have redness around your incision because there are stitches under the skin that are dissolving usually, and there's some inflammation with that process. But having inflammation and redness that extends away from the incision, starting to have fevers, areas become painful and firm, this is not normal. And the sooner you let your surgeon know, the more likely it is to be managed quickly and not require any intervention. So say you are one of these patients who gets redness that extends from your incision, a hard, painful red area, fevers, and we find that you have an infected fluid collection. So infected collections always need to be drained. They're just not going to go away on their own with antibiotics. So since they're typically close to a surgical incision, we usually just open the incision up a little bit, drain the infected fluid, give you some antibiotics. I typically culture the fluid, give you some antibiotics that cover the bacteria, and patients usually respond and get better very quickly. So in my experience, usually when this happens, there's associated area of fat necrosis. So fat necrosis is common with breast surgery. Often little areas will just resolve on their own, but if bacteria get a hold of that area, it's just a breeding ground for an infection. And the bacteria that we typically see for breast surgery is from the breast microbiome. So your ductal tissue our ducts are open through the nipple. There's often bacteria in there. It's similar bacteria that you find on the skin. And luckily, these aren't very virulent, aggressive bacteria that require aggressive interventions to treat or aggressive antibiotics. A much different scenario, of course, than say you have surgery in your abdomen. The bacteria that are in your GI tract are much more complicated to treat typically than the bacteria in your breast. So luckily, like I said, infections for this type of surgery are rare, and when they do happen, they're usually fairly easy to treat. And intervening quickly will always lead to a better cosmetic outcome. So it's important for you as a patient to just take an inventory of the area daily for at least 2 or 3 months after surgery. Make sure nothing is changing, and if it does, alert your team right away, so hopefully things can be managed swiftly and it won't lead to any type of deformity of your breast.